One of the first things you notice about someone, whether they're strangers or familiar, is their smile. And that's really, really important. A smile tells you so much about a person. It tells you something about their mental health, something about their physical health, and oftentimes something about their spiritual health, if you subscribe to those things. And so joining me today is Dr. Marjorie Cabell, DDS. She's been a dentist for many years, both in the civilian sector and in the military sector. And so she is going to discuss the dynamics of dental health. And this will be very, very valuable, especially with the holidays coming around and thinking about the things that you're about to stick in your mouth. So, with that being said, get your notebooks ready, get your mental health ready, and get your memories ready, and enjoy the conversation. Let's go. And today on Voices, I am very pleased to get to have a conversation with a person that's very near and dear to me. I learned a lot from her. And so she's contributing today. This is Dr. Marjorie Cabell. She is a dentist. She's been a dentist for some time now. She's a very seasoned and smart professional. Dr. Cabell, thank you for being on today. How are you?
Well, thank you, Mr. Nesbitt, Lewis Nesbitt. Thank you for a gracious introduction.
You are welcome. And I feel like no one can give a better introduction for themselves than themselves. So what would you want people to know about you as we start the conversation?
Well, I've been a dentist practicing since 1996. I graduated from Temple Dental School. I went to um, Southern University. I grew up in Evansville, Indiana, and I'm fulfilling a childhood dream of becoming a dentist. I've been wanting to be a dentist since high school. So God is good.
And so just with obviously the introduction question, so you wanted to be a dentist since high school. So what inspired that? Because there's all kinds of dreams, and to be a dentist seems like a very specific one. So what inspired you to want to be a dentist?
Well, I love biology. I always did, and love nature. So it gave me an opportunity to combine interests in biology and engineering to heal, build, and refurbish. Also had gotten a full scholarship to Purdue University, but
Wow.
life changes happen, and so to become a industrial engineer, and but I wanted to be a dentist, and Purdue University was big on engineering back in those days, and I loved that. We went on a career day for health professions. I was invited biology teacher, Miss Fleck, at North High School. And from there, I was introduced to dentistry. And so right away, I gave a report, and it just stuck with me, and things just happened. And I worked toward that goal, been working toward that goal to be a better dentist each and every day, even though I've graduated, long ago. It's still so much more to learn, and dentistry is vast now, and more people are learning about the importance of oral health. So we as dentists are able to reach a wide variety of people and provide a greater variety of dental services that help so many people change their lives.
And you bring up an interesting point about a variety of people. So we came to know each other from my time in the military, and you taught me so much about dentistry and as a field. So what was your inspiration to be a dentist in the military? Because it's really interesting that when people think of the military, I don't think they think of health professions, but you saw a way for yourself.
Yeah, it was, well, in those days, it wasn't, in 96, corporations weren't that big. It was still private practices. And, but the military always knew that having the soldiers or the airmen fit to fight was crucial. And to outsource that, to have somebody locally or right on the base where the troops can go right to them, have a facility to bring the dentists there that they could also provide a livelihood for dentists and a way to practice our profession and to help the soldiers, help the country. And I was recruited, and I took advantage of that opportunity. And of course, my love to travel, it was just a great combination.
And so, what are some of the places that you got to go being in the military? Because I obviously saw the United States and some of Europe, but I know your resume is way more expansive than mine.
Yeah, a lot of my colleagues are even more, but I'm very proud and excited to share that with you. My first duty station was in Texas, Abilene, Texas. I had lived in Houston, Texas before that, but I returned to Abilene, which is a smaller uh, community, and um, at Dyess Air Force Base. Then I went to Okinawa, Japan, and then that's what I met you in England, at Lakenheath, England. From there, I came back to the States and was stationed in Herbertfield, Florida. And I decided to separate. I got out of the military, opened my own practice. And now here I am. I decided to um, open a private practice in Georgia. And then I found a new need to I saw a lot of colleagues needed to get away from their practice, or life happens with various colleagues, and I found a way to help us out, and by you know substituting by becoming a temporary dentist, which we call local tenens. So I provide those services now, which I still serve the military, because military installations, a lot of the troops, they need like a weekend, like a Saturday and Sunday, doing dental exams and making sure that those soldiers are fit to fight.
And it's really amazing because I know that the difference between doing dentistry in the United States in the military is generally all active duty or reservist. But when you go abroad, you actually come across civilians. And so when you came back, you said you were in the States and then you separated. And so what was your uh, opinion or sort of evaluation of the differences between the military patient or the military dentistry and the civilian dentistry? What would you say are sort of the differences between the two?
Well, um, in the military, everything is more structured. Everybody knows why they're there. They know what they have to do, the end result. Uh, they know that they don't have a choice but to be healthy. They want to be healthy. Most people want to be healthy. And the facility is available. Being a civilian dentist, people are paying. And so they have other choices to make. They maybe want to go on vacation as opposed to getting their tooth filled, or to getting those teeth replaced. And maybe they don't realize the importance of their oral health. That they see the more pleasure of going on vacation, or as opposed to like in the military, you know, everything is provided. So you have a more willing patient in the military. When I see military people in my civilian practices throughout the United States, um, they're healthy. They're more healthy coming out because.
So because you had the opportunity to work with military and civilian dental practices, what would you say are the differences between the two?
Well, in the military, everything is more structured and laid out and pre-planned, whereas a civilian, you get to create your own structure and prioritize. The patients seem to be, when I see patients in civilian practices, I that were in the military, they seem to be more healthier because they prioritize differently, and they prioritize their health because they don't have the life um, type of distractions. that would prevent them from taking care of themselves.
Yeah, and you actually mentioned something about life with innovation, because what you said you did with dentists now is very innovative, and I'm sure it may have existed or not, but you said you travel to other dentists and help them who are in private practice, because people tend to forget that when you're in private practice, like, and you're the dentist, you're the specialist. There's no like substitute teacher or anything like that. So now that it sounds like you've innovated and created something along the lines of that. So can you explain what that is?
Yes, well, I don't really know if I, innovated it or created it, but I'm a contributor. When I opened my practice, I was by myself, and um, I couldn't get away. It was hard to, close the office, even if I planned a vacation or something. Then it was hard to get away and just take that vacation or do training, because as dentists you have to go to get continuous education. And so um, I would stop or cancel, my wait time to see patients. And also while I'm practicing or something, um, my colleagues, they were having the same thing. Oh, I can't get away. Um, and even now, corporations have expanded the the oral health care, the importance of oral health care. Um, I see that you know they still have a turnover in their offices. The larger it is, you have a turnover, and when you're by yourself, you need to get away. So um, I found myself, you know, whenever I had a small practice, and so those times that maybe I was closed, or um, if it was slower, I could, see my colleagues' patients. So um, I just kind of combined the need, saw the need, and put my name out there, or various one would call me, and I would say, "Oh yeah, well I have time." And I would always open on Fridays. I was always open on Fridays or Saturdays. My office was close to my house, and so. Um, I was always open or available and see emergencies. I was near the Atlanta Motor Speedway, and uh, travelers that came in, they would break a tooth or something, and I would be able to see them. And then I'd have staff that were close. So I just combined the two, um, uh, the different needs of everyone, and it's been fulfilling to me because it gets me away, keeps my desire to travel. So um, that's how that happened, and um, I'm really happy about it, and
So you kind of got
I
the
think that it serves everyone.
you kind of got the benefits of the military without having to wear a uniform, which I think is really cool.
You're so smart. Yes, that's right.
That's that
That's right.
that's really cool. And the thing about it is I think it affects the sort of the mental and probably the physical health of the dentist, because just to know I can't ever leave my work. And so that's sort of the I guess the lower part of entrepreneurship, right?
Exactly. Yeah. Because, when you're in private practice, if you're away, that's just, you've lost something. And it could even, um, because it affects everybody. If you're not there, then, maybe your staff is not able to work either, because it might not be a need for them to be there if you're not there to help you serve the patient. So, yeah, it really sufficed to, it really took care of the two needs, um, and
Because
desires, to serve the public and for me to get away. And I've met so many different people and other colleagues, and see how they practice and bring it home, and um, and just serve the public in a different way.
that's awesome. And And so the thing about it is I don't think they really understand the importance of, sort of dental health. So for you, what do you think are the most common dental issues either that you've seen or that you're aware of? And how can people reduce the occurrence of those things? Because I think people undervalue dental health.
The most common dental issues are still preventable disease, tooth loss. And the way to prevent that is education and then compliance. Like with me, I still like to do that full comprehensive exam when I meet someone, when I meet a new patient. I want to know everything about them with their health. And that even goes with mental health too. A lot of people have preconceived notions about dentistry. And um, so, in talking to them, they get to ask a question, and I get an opportunity to answer the question and educate them. And I become educated too, because you wouldn't have any idea what someone is thinking and feeling unless you talk to them. Then you can move on. Once they become educated and we both become on the same page, then we can develop a treatment plan, an agreeable treatment plan. I don't start anything until the patient understands what their problem is or what I see that their oral health concern, what I'm concerned about looking at their oral health and uh, in correlation to what they've explained that brought them to the office. And with that, having them to comply. Some people, even if they understand that, they're reluctant to comply. Again, for other reasons. Maybe they have to go on vacation, they have a prior commitment, whether it's work or family. And so by, you know, educating and agreeing and compliance, those preventable diseases can be resolved. And with that, after they become healthy, then follow up come that twice a year or the recommended annual visits, whether it's twice a year or once a year. Some people want, once they get healthy, they could come just once a year. Some people need to come more frequently, 3 or 4 times a year, with gum disease or, um, but usually after the education and the treatment, you can resolve or minimize the tooth decay and tooth loss.
And so to piggyback that, people tend to not realize, and I think you probably can explain this pretty well, but like your overall dental health actually gives signs to how your actual physical health is. That it often does that, right? And normally, if your mouth is in kind of iffy shape, that your physical body is normally kind of in iffy shape, and starting with dental health can help you, right?
Yes, I have documented some um, oral health conditions. For instance, uh, you'll see someone come in and they look really haggard, or and they're just nothing is going right. You know, maybe they're even unemployed, and that's a burden too if you don't know where your livelihood is coming from. That could be a mental stressor as well as physical stressor and contribute. If you can't eat properly, it affects your nutrition. And once they're restored, you just see a total different person. They look younger, they've gotten a new job, it gives them more confidence, and that's rewarding for everybody. You know, the gift is uh, just as the gift is more just as important to the giver as it is to the receiver.
Oh, absolutely. So, with that, knowing that you can see a lot of things just from their mouth, like you can tell a lot of other things. What are some of the highlights of your dental career so far? Because I remember some cases we did where we worked with children, we worked with adults, and some of them were longer cases, some of them were short. But what are some of the highlights? Because you're still doing it, so obviously you're still building that resume.
Yep. Well, you can, through your oral health, we do that head, face, and neck exam. You could diagnose, or you can find like nodules, or be able to refer to more of a specialist, maybe oral cancers, um, different, just the more common problems, even, the high blood pressure and diabetes, is correlated to periodontal disease. And by reducing that, people improve their oral health. I still see those, impacted teeth or infections. You could diagnose that. Metastatic type of cancers, meaning, they have migrated to the oral cavity from somewhere else. But, if you get to the root of the problem, you could refer that person to the right medical or oral surgeon support that makes a more healthy community.
Absolutely. And so, what are some of the untrue and some of the true assumptions made about dentists and dentistry? Because there's all kinds out there that, oh, well, dentists do this and dentistry
Yeah.
is this. So what are some of the ones that are true and are untrue?
Oh, yep. Well, dentists are not real doctors. That's one. They'll say, "Oh, I'm gonna go to my real doctor." Well, um, then that they could get the dental good dentistry cheaper in another country. Well, the quality of care is important. We don't just look at teeth; we're looking at the whole person, and that is just to touch on a few that that we're rich, and um, that we're doing this easy and should be free. Well, our overhead is very high. That is really true. So it's hard to, you know, do that at a bargain. Um, and so, dentistry is painful, and not to say that, well, anything could be painful, but some of the uh, medical procedures I see, is uh, on television, that you see, when to the OR, and someone getting a needle, and all tubings in their arms, all over their body. I had a patient that tell me just the other day, "Oh, medical, they could do anything. They could cut me open, I could look at it, but I just can't, get a shot for at the dentist." So we worked through that. I made that analogy. I'm like, "Oh, okay." So, but we worked through that. She's like, "Oh, no, it wasn't painful." And I get that a lot. "Oh, well," but that's a old, antiquated mindset, from because I guess, historically, eh, dentistry was painful because they didn't have anesthetic um, back in the olden days, and I believe that's changing. People are more willing to get dental procedures now.
Yeah, and so what are some mindsets or mentalities or some tricks that you could tell someone to say, hey, yeah, I understand you're afraid of the dentist for this or this or this, but if you do this, it'll help you when you go to the dentist. Do you have any of those tricks available?
You breathe.
Oh, okay.
Yeah, any fear is fear, no matter whether it's of a dog, of of peanuts. I've met people that are afraid of peanuts, that are of whatever you're afraid of. If you just breathe first, relax, step back, you know, um, don't panic. Just relax, breathe, ask questions. Share, and why, I'm thinking that this might happen if you do this, if but once you relax and talk to the patient, and find out those triggers for them, and or where they are. Some people, they want, well, if you just tell me everything that you're going to do, well, then, I can probably get through this. Or, um, so I do that. I find out where they are, and um, we talk first, and I give them a choice. Are you ready to start? And we don't have to start that day. You go home and think about this, and let's see, I'm going to be here, or one of my colleagues will be here, and I'll pass on what you want, and so we don't have to do everything today. We plan to do this, but we're just going to do this. So they're in control, and that helps relieve fear. That's with anything, you and I, if whatever fears that we might have, anybody, if you think about it, it's like, what would relieve, if I was afraid of something, what would I want to happen, and how could I meet this person in, um, show them the benefit, and that's what I found to work.
Oh, cool. And so, how can you advise or maybe give some suggestions on how a person could choose a dentist? Because I think that's something that matters too. Is if you have the right relationship with your dentist, it probably won't feel like a work or difficult. So, how do you recommend someone choose a dentist?
Knowing yourself, uh, being honest with yourself. There are different, you know, mediums to locate a dentist nowadays. Word of mouth is good. Do you have a friend that went to a dentist? They're different. If you um, are the HR department and their work environments, they have a referral list. Um, to select from, and insurance companies, have a referral list, or just stop by uh, the dental office. So just anything that where you feel comfortable. Um, our bodies, our minds don't fool us. When we feel comfortable, we could look at a building and say, "Hey, that looks like a place that is inviting." Stop rested in I need some dental work, and I'm looking for a dentist. And how do you do things? Or and say that if you get a warm reception, or a feeling about that you would be happy there, you'll probably be happy there. And after you have that initial appointment, that's when we get to know one another. If you feel comfortable, then that'll probably be a good fit for you. And ask questions and talk to them, um, to see what your options are for what your treatment. We don't mind second opinions, uh, on because there are different ways to come to the same, and so just go with your gut feeling.
Awesome. So with that, I think being a dentist is really cool. But I got to meet a ton of dentists. I worked with a bunch of different ones while I was in the military. Um, if you were advising someone who said, "Oh, they're just like you when you were a kid, and they're interested in entering the career field," what would you sort of advise them kind of learn before they say, "Okay, well, let me go and take this step into going into dentistry"? Like, what would you advise some steps for them to take to become a part of the field?
Hmm. Uh, Well, depends on where they're um, discovering that um, question about themselves, their interests. At what age are they just coming out of high school? I've mentored a couple people, well, more than a couple, at different stages of their life. For instance, I've met young children, like you know, but or if at any stage you're afraid of blood, I'm not going to say you can't be a dentist, but at some phase of your training, you're going to have to face blood. And I've gone to school with dentists who have gone through the training and decided that's a that's a costly. lesson. But it happens. But if you when you I don't discourage anyone. Do the training. It's a lot of undergrad, uh, didactic stuff that you would have to, a lot of didactic information, a lot of studying, a lot of reading. If you don't like to read, if you don't like blood, um, then it might be something to take a second look at in a different way, from a different angle. Um, we don't always have to treat patients being a dentist. There are different administrative um, avenues you can go if you want to be a part of it. It really helps if you have a science background of, studied or um, been familiar with dentists who have a background in engineering, in the stock market, in business. Um, and they become fine dentists. Uh, but you have to realize, how are you correlating that? The Can you take criticism? Um, because it's a lot of that. We are under a lot of scrutiny through undergraduate and dental school, and after, and through your profession. So you have to be able to know yourself and know what you know and know what you don't know, and not try to know everything.
That makes sense. So I have two more questions, well, three more questions, and then we'll start to wrap up. So you've done and you've seen a lot. So what are some of the success stories that you remember the most about being a dentist?
Oh, in what regard?
Anything you would sort of deem a success, because I know there's different things where maybe you helped a patient who started in a sort of rough shape and then you got them to great dental health, or a difficult case you dealt with and you were able to overcome it.
Yes, well, you like doing full, reconstruction of some sort. And not everybody has $30,000 or lots of money to contribute, to their oral health. But everybody should or can have really good oral health. And I could name a lot of. I have a lot of experiences. One lady that I remember, she had um, she, 20 teeth remaining, and every one of them were decayed. And so I was able to give her uh, a improve her smile, and with full dentures immediately. She walked out one day. She came in one day with 20 non-restorable teeth, and she had a comfortable set of immediate dentures. And that was the one that left the most impact on me. And um, also, um, as far as pediatric dentistry, the children are important because children, they're not able to convey their pain or how they're feeling or articulate it. Um, and this child was just, you know, deemed to be uncooperative, or had been to, um, throughout the family, oh, they just won't be still. Well, the child was in pain. So we took care of that child, and it was just a different person. Did better in school and everything. And that lady, that I was talking about with the complete denture, she wanted, uh, she was a sociable person, beautiful lady, and she liked to smile, but she couldn't smile. She wanted to be a participate in her social, working with young adults, and um, so she's like, they're starting to ask me about my teeth and why don't I smile. Well, she was in a lot of pain too, because she had a lot of infections. A lot of people don't come to the dentist until they have an infection or pain. And so by restoring that, she was able to serve her community even better, because what better way to outreach is being community active. Those are just of examples. I had one lady, another, she I restored her smile. She, always talked with her hand up to her face. And then after we finished restoring her smile, I invite her back for a follow-up, to make sure that her dentures fit well, and informed her that, she could probably get implants later, you know down the road, if the denture became loose. And but before, during that follow up, she explained to me, "Oh well, I want to return my dentures because my family, they said that I look funny because all my teeth are straight." I thought that was just weird, strange, and that I want to be a part of my family. So I had to convince her that, well, we all did. My whole staff, like we just we couldn't imagine that somebody wanted to rather be toothless than to have straight teeth. I said, you just tell your family, come and see us. We'll make you all look very acceptable, so she didn't return her dentures. You can't return the dentures, but I just thought that was um that left a lasting impression on me. um Also, diagnosing the I've been able to diagnose uh uncommon uh, lesions, and meaning lumps or bumps, and that were, you know, over or undiagnosed, and got a diagnosis by, referring them um, for various cancers, or um, just even benign lesions on their tongue or their throat, having problems swallowing, is a big thing. Even being able to find out why a person has bad breath is a systemic problem that usually contributes to that as well. And being able to, pinpoint what it is helps so many people. And you wouldn't think is, oh, they just don't brush their teeth, but you could meet someone that, they, oh, I brush every day. I don't know why, but someone told me I have bad breath. Well, getting to the root of that problem, you can imagine how that changes their life, because nobody wants the stigma of having any body odor.
Right. And so it sounds like dental health is very attached to mental health, and that's so you're kind of a psychologist at the same time.
Well, I guess, yeah. That is true. I'm not trying to get a new title as psychologist, but psychology goes with everything, finding out why, just having that conversation. And uh, is psychology is, you know, getting to the root of the problem so that everybody can progress and live happy.
Absolutely. So we talked a ton about your work, and so obviously you have to have a balance, because I think sometimes people miss that doctors and professionals like yourself have to have a life balance, because you don't want to carry things home from work. So, well, what kind of I guess life experiences do you look to embrace outside of dentistry so you can feel like you have a well-rounded life?
Well, I'm constantly planning my retirement, because I remember back in elementary school, we we were Mrs. Anderson. I remember back at Lincoln Elementary School in Evansville, Indiana. This sounds crazy, but you think about grooming for success. Uh, and success, I was always taught, came with that balance, um, your profession, your family, your friends, and having that balance, you needed some leisure time. Well, what I like to do is on different levels. I have daily leisure, which is exercise and weekly, going to church or traveling or a combination of the two, refurbishing, home renovations, and um, cooking. I love to cook. Probably should do that every day. If I'm home, I do cook every day because I like it. I like creating new recipes. Uh, and I'm constantly retirement. I don't really see myself ever retiring, just like sitting home, or doing that. Uh, and But I'm studying voiceover, uh, as well. I'm thinking of things that I could do when I'm not able to do dentistry, or if I'm not able to do dentistry, if this gift is taken away, um, would I be able to write or talk, or and I think that would be fun. So I'm studying voiceover. I'm excited about that. I participated in the AJC, the annual uh, July 4th 10K walk run, and I like that. That gets me out there. One of my patients, uh, she turned me on to doing that, and you know, so getting this old lady out there, she's a young lady, and so she says, Dr. Cabell, you need to, come and go walk with me and run. So, or so I go to the park almost every day, and we do something, and so that's enough right now, right? But and I like when I go to California, see my son. I like the beach and boating and anything in the water. I want to go snorkeling next year. I won't be able to do that until next year because uh, maybe the spring or summer. So.
Well, what's your favorite recipe? Because I know you were talking about like diet. So what's your favorite recipe being a dentist?
Uh-huh. I love vegetables, and I love fruits and vegetables. And there's a joke that I have with my friends. They talk about, oh, I've sinned because I had to eat pie. I said, wait a minute, what kind of pie was it? Was it sweet potato? Now, sweet potato is a vegetable. So I don't feel guilty about anything. There's a reason why you want to eat, it's food. I don't feel guilty about that. It's just overindulgence. I don't want to overindulge. You can get too much water, and that's a bad thing, actually. But uh, the sweet potato pie is not gonna hurt you. Just a little piece.
And so what inspired you about voiceover work? Because I think voiceover work is really cool. I've done a little bit of it myself. So what led you to that?
Oh well, I'm from Indiana, Evansville, Indiana, and I've always been told, no matter where I go, it's like they can't pinpoint where I'm from. And even from Evansville, that you don't talk like you're from us. Where you don't talk, even as a child, you talk different. Your voice is different. So I kind of use my voice to I don't try to talk it, just my voice. So uh, I it was one instance, a friend of mine was actually my brother's friend in my brother's age group. Um, his name is the friend's name was Lynn Harris. He went to the University of Evansville and had a radio spot at the University of Evansville. And he was in a crunch. I don't know. I was in high school, and I, it stopped by the radio station because we were all close, and so he's like, I need something, to go in this segment and whatever. So I, started talking, and then it was something that was going wrong. But anyway, he needed uh, music, and his music thing equipment wasn't working. So I started singing. He said, say something, just say something or sing. So that's what I did. Who was that on your show? People were asking, calling me, who was that on your show? fixed. And, and I went away to college. So, and he graduated, but we both got through that time. But, that was the tip of the iceberg. And I kind of put it away, and it was just, I would hear, different voices on the, for, commercials and everything. My brother is an actor, and he had done, his name is Cabell, and he did, some spots, and I don't know if he still does that. And he really has a voice, and we would always mimic one another and mimic uh, different personalities and whatnot. And I actually heard Oprah Winfrey, she says, I got a bad habit of mimicking people or whoever I'm talking to, she says, oh, that's rude. And I don't know, it's just, it just seemed fun. I even went to took a class here in Georgia, and uh, people said that I have a good voice for voiceover. Have you ever thought about voiceover?
Well, that sounds exciting. It sounds like you really will never retire because you'll always have options in front of you.
Well,
So,
you have to teach me more. Now I know that I have a, a colleague in voiceover.
I've done voiceovers for online classes and textbooks, and it was it is because I still do it. It's sort of at will whenever they call me, but it's always interesting because it's always something educational, and because I am and was in education, it's something that I found interesting.
Well, you
And
really
so
have the voice for it. Yes, you do.
I don't know. I kind of did the same thing you did. People said, "Hey, you should try so and so." So I said, "You know what? Why not?
Yeah,
I'll put my voice out there, and whatever happens, happens."
right, right. So we'll see what's going to happen. I look forward to sharing on that more.
Oh, absolutely. So as we wrap up, we've covered a lot of things. I really wanted to focus on dental health because I think people may not necessarily understand how important dental health is. But with that, on this podcast, my goal is for the voice of the guest to always end the show. I think what you have to say is really important. And so I leave the final word to you, and I tell you that you can talk about the topic we've discussed, or you can share some words that are on your heart that you want the public to know. Either or, you get the final word, and I thank you for that final word.
Well, thank you. I just wanted to say in closing that oral health can change your life. Uh, most people are most people are preventing or pursuing oral health because of fear. The best way to head off fear is to, first of all, breathe, face it head on, whatever the problem is. See your dentist, get educated, comply, and agree to the recommendations.